Thanks, Carly. Alright, now hopefully this works.
Actually record it this time.
Okay, ready? Go. Go. Okay, pecto antebrachialis. Pectoralis major. Pectoralis minor. Xiphoid humoralis. Okay? This flap of muscle here is the epitrochlearis. If we move all these out of the way, that right there is your bicep brachii. Okay? And we already know this is the brachialis up here, right? We did that last week. Okay? These are your serratus ventralis muscles here. That right there, along the medial border, right there, the scalene. Okay. Coming down here, we have the obliques. So you have your external oblique, your internal oblique, and your transverse oblique. 3 layers. Okay. This is the linea alba here, and these muscles running right up and down here on either side of the linea alba and the rectus abdominis. Coming down to the leg, let's do the outside of the leg first. Okay, this big beefy muscle on the outside of the thigh here is the bicep femoris. We can move that out of the way to show you the the sciatic nerve. Okay. Another superficial muscle on the outside of the thigh is this one right here. Right there. That's the tensor fasciae latae, right? All this fascia. Okay? This big muscle right here that's been cut so we can see under it, but this big muscle right here is the sartorius muscle. It's coming from the iliac crest, coming all the way around, wrapped around the knee, just like in the human. Big long strap of muscle. Okay? Turn it over to see the butt. The butt muscles, again, are named the opposite for the human. The big fleshy muscle here is the gluteus medius or gluteus minimus, whichever one you want to call it is fine. Okay, that's the big one. The gluteus maximus is the strap that goes underneath it. And this third one down here is the caudofemoralis. That's the one that's going to move the tail. Okay? Alright. Then we can turn him over to look at the inner thigh. Okay, the inside of the thigh is covered by this long sheet of muscle here. This is the gracilis. So we're going to move that gracilis out of the way so we can look at the adductor muscles. The adductor muscles bring the leg in this way, right? Okay? So you look for your femoral triangle, which is where your femoral vein and your femoral artery and your femoral nerve are. We're going to pull those out of the way. Right next to that femoral vein, deep right here, is the smallest adductor. That's the pectineus. See, this is better than your cat.
Yeah, that's way better.
This is the pectineus right here. The next one out, this one right here, is the longus, the adductor longus. And then this one right here with the 2 heads, this is the adductor femoris. And then this one, this big fleshy one in the back, is the semimembranosus. Okay? So if we pull that gracilis back over, and a lot of times you'll see athletes grab the back of their leg, saying, oh, they pull their hamstring. This is your hamstring. That's the semitendinosus, the strap right in the back. Okay? And if we move down to the leg, the big calf muscle right here, that's the gracilis. Oh, no, that's the gastrocnemius. Duh. That's the gastrocnemius. Under the gastrocnemius is the soleus muscle. And those both come down and insert on that calcaneal tendon, and yours is really stiff. Right? The Achilles tendon to move the foot. Okay? Good? Did you get the muscles of the neck? Want to do those quick? Okay? So the ones right up front here, these are the sternohyoids, because they're going from the sternum up to the hyoid bone. The next set out, lateral from that, is this over here, and what's left of the one over here on this side. Those are the sternothyroids, because they're going from the sternum to the thyroid cartilage, not all the way up here to the hyoid, right? So these would be the sternothyroids. The next one lateral to those is this big one right here, makes a big V in the neck. These are the sternomastoids, coming from the mastoid process in the back of the skull, coming around to the front to the sternum. And then deep and lateral to that is these straps of muscle here. These are the cleidomastoids. Those are also coming from the mastoid, but they're going straight over onto the clavicle. Okay? So we have hyoid, thyroid, sternomastoid, cleidomastoid. Okay? Then if we look up here, running right along the bottom of the mandible, these are the digastric muscles. Okay? And the V in between here, those are the mylohyoids. And the masseter muscles are the big muscles over on the cheek. Okay? Not too bad.
Did you get it that time?